Alrighty, I think let's go ahead and get started. Thank you for joining everybody for our coffee break today. Today we're going to be talking about the consumer engagement and healthcare survey that we conduct in partnership with eBree. We fielded this last year, and we're going to be going through a handful of select results from the survey, mainly focusing in on questions that were new this year, kind of some hot topics. But Sarah, I'll go ahead and turn it over to you and let you get started.
Great. Well, as Greg said, thanks for joining us this morning. Just going to quickly go over a couple points from the methodology before we get started, just so we can sort of wrap our heads around the survey itself. So this is a long-trended study. This is the 19th year that we've done it. We survey Americans aged 21 to 64 who are on a private health insurance plan. In total, we had 2,020 completes this year, and that includes people who are either on a traditional plan or a high deductible health plan. We field in the fall, sort of around that open enrollment or sort of just after that most popular open enrollment period. And the data is weighted to reflect the population. We weight by gender, age, income, ethnicity, education, and region. And so, as Greg mentioned, we're going to focus on topics that are fairly new this year. There are a lot of results that we could talk about with this survey, but given sort of our short amount of time, we really wanted to sort of focus on a few select things. So this first section that we're going to talk about are questions that really focus on this increase in healthcare costs. So the first slide, we asked consumers how their healthcare costs have changed in the past year, and 4 in 10 report that they saw increases in their cost. And this is higher than the number of people who reported that last year. Last year, 32% reported seeing increases. And high deductible health plan members were more likely than traditional plan members to report that their cost had increased. And so on the next slide, this is a new question this year. We wanted to see exactly where these members were seeing the increases. And the top answer was in their insurance premium. And high deductible health plan members were especially likely to say this, especially compared to those traditional members. They were also more likely than traditional members to report seeing higher deductibles, higher out-of-pocket maximum, and increased co-insurance. So really sort of seeing those higher costs. And then as a result of these higher costs that people are seeing, consumers have had to make changes in their spending sort of overall through different aspects of their life. And we saw 2 in 3 reporting that they had to reduce their discretionary spending as a result of these increased healthcare costs. Half reported that they decreased contributions to other savings, and 44% said that they had to increase their credit card debt. And these 3 actions specifically, more people reported having to do those this year than what we saw when we asked this question last year. We also had 4 in 10 report that they had to put off or delay medical care as a result of this increased spending in their healthcare expenses. And then on the next slide, sort of looking at their health plan overall and how it compares to 2 years ago, 7 in 10 of those who have been on their plan for at least 2 years said that it does feel the same compared to 2 years ago. However, 1 in 10 do report that it feels worse. And high deductible health plan members were twice as likely as traditional plan members to say that they feel this way, to say that it feels worse than it did 2 years ago. And so we asked, why? Why does your health plan feel worse than it did 2 years ago? Cost. Higher costs were the top reasons, with 8 in 10 saying it was because of higher deductibles and 2/3 saying that their plan feels worse because of higher premiums. So these higher costs are really sort of popping out in multiple questions in multiple ways. So in the next news section, as we saw earlier, some consumers are saying that they delayed Sorry, is there a question? No? Okay. So as we saw on earlier slide, consumers said that they were delaying or avoiding medical care. So this year we wanted to sort of dig deeper into what was going on there, what care is being delayed, why are people delaying their care. So on this slide, we're looking at a few different types of care and sort of seeing what was most delayed, what's getting avoided. And the top one is mental health care. And this is among people who said that they needed the care. So just wanted to sort of caveat that. So 4 in 10 reported that they needed mental health care and delayed or avoided getting it. Not 3 in 10, I apologize. 1 in 3 reported that they delayed or avoided getting physical therapy that they needed. And about 1 in 4 said that they delayed or avoided visiting a specialist office if they needed to, or delayed or avoided a visit to hospital outpatient care or needed surgery. Other care that we asked about, few less people delayed or avoided this. Fewer said that they delayed or avoided needed visits to the ER, lab tests, visiting their primary care doctor, or needed prescription drugs. And one thing to point out for this slide and the previous slide, we did not see any significant differences by plan types. So this does seem to be sort of a universal experience among the consumers, with the mental health care being that needed care that gets delayed or avoided the most. Whereas the visits to the primary care doctor or prescription drugs, the people who need that do get that. And then on the next one, we asked, okay, why did you delay or avoid seeking that care? Among those who said they delayed or avoided any of the following that we just talked to. Perhaps not surprisingly, given results that we just talked about, cost plays a big portion. 53% said that they delayed or avoided getting their needed care because they did not have or they didn't want to spend the money. Also not surprising given some of the other results that we just talked about. High deductible health plan members are more likely to say that this is the reason compared to traditional plan members. So that was a very quick sort of overview, but as we can see, cost is sort of having this impact throughout, and we're seeing people delay medical care because of it. So Greg, I'll turn it over to you to talk about some of the other new findings.
Sure. Thanks, Sarah. So the last two sections here that we wanted to cover today were really around some of the hot topics in the regulatory landscape. The first one being care locations. And in recent years, care has been shifting from physicians' offices to more costly hospital outpatient departments in certain areas, as hospitals are acquiring independent physician practices. However, hospital services tend to often be, more expensive, even when similar care services can be provided in different care settings. So Congress has had its eye on what they refer to as site neutrality of care, and there's been some legislation going through the House. Just recently, I believe last month, site neutrality of care was actually dropped from the legislation. The thought being that hospitals have a lot more overhead, so that's kind of the justification for higher costs at hospitals. But the idea is that site neutrality of care would hold costs steady for such services, regardless of where they're performed. So we decided to ask consumers, where would they prefer to have certain services performed? And looking at this chart, aside from MRI imaging, most prefer tasks to be performed at physicians' offices, so not at a hospital-based outpatient facility. You'll see non-MRI imaging, about 7 in 10. Lab services, half would prefer to have that at their physician's office, about a third at the lab, and only 20% at a hospital-based facility. Specialty medication distribution, again, 6 in 10 would prefer that to be at the physician's office or even sent directly to their home, where about 1 in 5 would prefer that. MRI imaging is a little bit different, with most folks, a slight majority preferring to have that done at a hospital-based outpatient facility. And for all of these items, high deductible plan owners are more likely than traditional plans to prefer a physician's office, especially for lab services and at home for specialty medication distribution. So we asked if they would be willing to pay more for each service to be performed at their preferred facility. And for most of these services, about a third say that they would be willing to pay more to have them done at their preferred facility. Given that most preferred facilities are physicians' offices, it seems that the opposite is actually happening right now, where people are having to pay more to have services done at non-preferred locations. Probably not a surprise that high deductible plan owners are less likely to be willing to pay more for all of these, as generally speaking, high deductible plan owners tend to be lower income. So there's little indication that consumers believe physicians that are tied to hospital systems are better quality physicians than others, where you see 52% disagree that they're better. And what is it? 7 in 10 disagree that higher costs are an indicator of higher quality. So even if folks are being, routed to get these services done at hospitals, they don't necessarily think that they're getting a premium in terms of care by paying more to get those services done, not at their physician's office. So in conclusion here, consumers are mostly preferring physician offices for these services, with, again, the exception of MRIs. They would be willing to pay more to have those services done there, and they largely disagree that hospital systems, physicians tied to hospital systems, are of better quality. And again, as I mentioned last month, the Senate stripped the site neutrality of payment for lower costs from the Lower Costs and More Transparency Act. So this is still, an outstanding issue. And the last piece we wanted to touch on today is around preventive care. And this is around pre-deductible and zero out-of-pocket coverage of preventive care, which the ACA mandates that certain preventive care measures are covered on a pre-deductible basis. Some of these requirements were challenged in a court case last year, the Braidwood case, that ultimately ruled that some of the aspects of those requirements were unconstitutional. Now, this doesn't affect all of I believe there's 500 plus preventive care type screenings. It doesn't affect all of them. I believe the number is around 35. But there's certain preventive care measures now that are not required to be covered on a pre-deductible basis. And we took a look here at a handful of those services. So we asked first if the consumer or someone else on their plan had received any of these types of preventive care in the last year. About a quarter have received cancer screenings, and much fewer for some of these other items. So screening for anxiety, behavioral counseling, preventive interventions for perinatal depression, etc. And my cat has joined me. Hi, everyone. Throw her to the side for a second. And then we followed up by asking if they were required, if these services required a co-payment or co-insurance, which would they be willing to pay out of pocket for? And you'll see cancer screenings rose to the top. About 7 in 10 would be willing to pay out of pocket for cancer screenings. And then the rest are around there, hovering around 50% in terms of willingness to pay. And again, traditional plan owners are more willing to pay out of pocket than those who own high deductible plans. And this is a continuation of the last slide, just with some other preventive care items. So again, we're around 50% for perinatal depression, and screening on HIV screenings for pregnant women. So I think in conclusion for this item, while many of these preventive services aren't really taken advantage of by most folks, about half are still willing to pay out of pocket for them, but that still means you have half who would be cut out, not cut out, but less likely to be receiving this care because they don't want to pay for it. And it's also, an equity issue as we look at high deductible plan owners versus traditional plan owners. And again, high deductible plan owners less likely to be willing to pay, and they tend to be the folks who have fewer resources. So those are the questions that we wanted to get through today, or the new questions from our survey, but wanted to leave a little bit of room for discussion if anyone has any comments, questions on what we've gone through.
You can either just unmute yourself and yell them out, or type them in the chat box, whichever works best for you if you have any questions. Or if you think of one later, you can always email us.
But all right, guys. Well, thanks everybody for attending. Happy Friday. Happy Masters watching if that's your thing. I'm excited to do that this weekend. But feel free to, we're going to post this on our website. And if you have interest in sponsoring this year's Consumer Engagement and Healthcare Survey, reach out to Sarah or myself. We'll be fielding, I believe, in the fall again. Mm-hmm. All right. Thanks all.
Okay, thanks, everyone.
Thank you.